Hi. Today we're going to talk about improving the practice of stroke discharge teaching among novice nurses on a stroke unit. As you know, nurses have many responsibilities, and one of the most important of these is preparing patients for discharge.
So, what are we talking about when we talk about stroke discharge teaching?
Thanks for asking that, Stephen. One of the main goals of stroke discharge teaching is to give the patient and their caregivers a sense of preparedness and confidence as they face the transition from hospital to home.
Why is discharge teaching so important for stroke patients?
Good question, Teresa. Stroke discharge teaching is part of the Canadian Heart and Stroke Best Practice Guidelines. When a stroke patient is medically stable, the clinical team works with the patient and their family to assess how the stroke has affected the patient's ability to resume their activities of daily living. They collaboratively form a plan of care and determine the teaching that must be done before the patient can safely leave the hospital. Ineffective discharge teaching can result in a lack of patient understanding, low readiness for discharge, poor post-discharge coping, non-adherence to treatment that may prolong their recovery, increased emergency room visits, and readmission.
Wow, that's a lot of pressure. But I feel like we didn't receive a lot of training on discharge teaching in nursing school. I think that's why I don't have a lot of confidence.
To be honest, I still get nervous, and I've been a nurse on this unit for 2 years. I feel like there's just so many things to do, and I don't have a lot of confidence with teaching either.
You know what? That's normal. According to the literature, in nursing school there are many barriers to nursing communication training and nursing discharge teaching. These include large class sizes, limited class time, inconsistency in clinical instructors discussing and evaluating students' discharge teaching, and few opportunities for practice. In the workplace, barriers include heavy workloads and competing priorities, shortage of time at the bedside, increased acuity of cases and complexity of care, and decreased staffing. There can also be barriers of nurse self-efficacy, for example, lack of knowledge of what to teach. And nurses lack confidence with their ability to use patient teaching principles such as patient engagement, motivational interviewing, and adult learning theory.
Well, I'm glad I'm not the only one, but I think I would be less shy to teach patients if I knew more about the patient teaching principles that you mentioned earlier. Can you tell us more about those?
Sure. You know what? I'll give you some things to read, and we can meet after second break, and we'll talk about them. So I gave you guys some things to read about patient engagement, motivational interviewing, and adult learning theory. What do you think?
I think that, in the context of patient teaching, adult learning theory and patient engagement work well together. They both talk about taking time to understand the patient and family's values and goals so they can share the decision-making about what will be best for them in their recovery. I also found it interesting that you can look at engagement as in involving the patient and family in shared decision-making. But you can also look at it like, are they ready and able to engage in the plan?
Those are important observations, Teresa. Stephen, what was your takeaway?
I was really interested in the article on motivational interviewing. Asking, informing, listening, these are things I can remember. But for discharge teaching, I think I would really need to practice with patients.
I'm glad you said that. I happen to have another activity for us today. Stephen, since you mentioned you wanted to practice with patients, I thought maybe you two would be interested in doing a role play simulation. What do you think?
Yes!
I'm too nervous.
Stephen, I'll understand if you really don't want to, but I'd like you to know that the nursing education research shows that role play activities can significantly improve nursing communication help to identify factors that affect patients' outcomes, and provide a safe space where you can explore new ways of behaving and communicating that you might not be used to, while reflecting on your own values and experience. Would you like to try it?
All right.
Yes!
Great! Okay, let's get started. For this role-play simulation, Stephen, you will play the nurse of the patient. If ever you feel uncomfortable or you're not sure what to say, just let us know and Teresa can step in as the nurse. I will facilitate the activity, and I will also voice the patient, Mr. Campo. This morning, Stephen, you spoke with the physiotherapist, and she said that when she went to visit Mr. Campo, he said that he didn't want to walk. How do you greet your patient?
Mr. Campo, the physiotherapist told me that you didn't want to walk today. Is that true?
Yeah, I'm tired this morning. I just want to sit and talk to my wife.
But if you don't walk every day, you won't be strong enough to go home. I don't know if I should say that. What would you say?
Teresa, would you like to take over?
Yeah, okay. Good morning, Mr. Campo. How are you doing today?
I'm tired.
That's understandable. You've been through a lot. I'm wondering, what are you looking forward to doing when you get home, which is coming soon?
I want to walk the dog and work in my garden.
Do you think that doing your exercises with the physiotherapist while you're here will help you feel more prepared to walk your dog and work in the garden by yourself when you get home?
Yes, I think so. And scene. I realized that was something new for you, but you really jumped right in. Now I'd like to ask you about your experience. Stephen, what was that like for you?
Well, it was awkward to be sure, but I really appreciated being able to try something out. And I know what I would do differently next time.
You were unsure about what you wanted to say to Mr. Campo. How would you do it differently next time?
I realized that when I asked the patient how he was, I wasn't really listening. That is what I would do differently next time.
Teresa, do you have any feedback for Stephen?
Yeah. From motivational interviewing, we also learned that we should resist telling the patient what to do and let them build on their own motivations.
Teresa, how did the role play feel for you?
I was thinking about adult learning theory, and I thought I should take the time to get to know my patient's values. So then I tried to think about how we could share information to align the goals of his recovery with the things that he wants for himself.
Thank you for your reflections. It sounds like both of you will be able to bring something from the role play into your practice. Would you agree?
Yes.
And would you be into trying it again?
Yes.
Thanks a lot for joining us to learn about stroke discharge teaching. Don't forget to read Your Stroke Journey, and don't hesitate to contact your nurse educator for any other learning materials. See you later.